share with you 5 amazing new discoveries in medicine that will help revolutionize our field. One is, have you seen people with shaking, that's familial tremor, or those with Parkinson? Well, there is now a new wearable device that's approved by the FDA that you can put on your wrist. There's one that they're working on, a ring that's not FDA approved yet, that is able to use AI to send signals and to reduce your tremor. Another exciting thing is very often I see patients with infections on their body. I treat their infections, but I know that if I don't treat the root, which sometimes hides in areas that do not respond very well to oral antibiotics, that's inside the nose. So I take a bacterial culture. Very often I find it's the same as on the skin. And if I don't treat them and the other host that may be the conduit harboring the infection, they will get the infection again. Well, this group in Hong Kong developed bots. They shoot them up the nose and infection is gone without any antibiotics. They've proved it in rabbits and pigs, and now they're offering it to humans. I wouldn't want to be the first to try, but you can use it in other locations, stomach and other areas as well, once that works. Another exciting thing is the idea that, there is a solution for stomach cancer. We know that was a Nobel Prize win from, I think it was 1986, by an Australian physician. They used to laugh at him, but he said bacteria actually causes it. It causes inflammation, as many cancers are caused, I believe, by virus and bacteria causing inflammation. This is something that you can prevent. Unfortunately, there is a huge rise in stomach cancer in people under the age of 50. Well, you can prevent it if you treat the source. In 76% of the time, it is actually the H. pylori, and you can do easy tests, go to your doctor, a breath test, or other tests, blood tests, and you can treat it with antibiotic and proton pump inhibitor and get rid of that inflammation that eats at the lining of your stomach and leads eventually to cancer. Another question is about the diets. Everybody's talking about different types of diet, intermittent fasting, low-calorie diet. Well, they did a study and they found that the most effective one to improve your insulin sensitivity, reduce triglycerides levels, and fasting glucose levels is actually something called the IER, which is intermittent energy restriction. What they did here is 2 days out of the week, they reduced the amount of calories, while all the other diets as well helped anyone with calorie restriction. This was more manageable. People tend to adhere to it more, and it worked very well. And the last and fourth things that I would like to share with you is sleep and food. Well, we know we should stop eating 3 hours before sleep. It doesn't exactly work for me. There is many reasons, because your sleep will be better, but does it make a difference what kind of food you eat? And the answer is yes. What they found was that if you eat sweet, spicy food, or food that you may be sensitive to, like milk, or if you have gluten sensitivity or lactose sensitivity, you may actually have nightmares. They may be very vivid, but do you really want them to bother your dreams and your sleep? No, unless you're trying to write one of those horror movies. Anyway, so 3 hours before, try not to take coffee or anything that will cause also heartburn. It will reduce your risk for cancer as well of the stomach. Hopefully this was educational. Trying to keep it short, sweet, to the point. God bless. Stay healthy. As we said, Levit dermatology, health and beauty is our duty. Be good, do good, say good, and may good come your way.